Imagine a world where the very institutions meant to protect us from harm become the targets of violence. This is the stark reality that unfolded recently in Atlanta, where a gunman opened fire on the U.S. Centers for Disease Control and Prevention, CDC, headquarters, leaving a trail of devastation and loss in its wake. But here's where it gets even more disturbing. The shooter's motivation, as revealed by his father, was a deep-seated belief that the COVID-19 vaccine had made him suicidal and depressed. This shocking incident raises fundamental questions about the impact of misinformation and the erosion of trust in our public health institutions. As we delve into the details of this tragic event, we'll explore the complexities of vaccine skepticism, the role of leadership in shaping public discourse, and the urgent need for a nuanced conversation about the intersection of health, science, and politics. The CDC shooter, identified as 30-year-old Patrick Joseph White, was armed with 5 guns, including at least 1 long gun, and attempted to breach the CDC's headquarters before being stopped by guards. He then drove to a nearby pharmacy and opened fire, mortally wounding DeKalb County police officer David Rose. The suspect's father, who contacted police to identify his son as the possible shooter, revealed that his son had become fixated on the COVID-19 vaccine, which he believed was responsible for his depression and suicidal thoughts. This fixation was not an isolated incident. White had reportedly spoken to neighbors about his distrust of COVID-19 vaccines, often bringing up the topic in unrelated conversations. His neighbor, Nancy Holst, described him as a good guy who seemed unsettled and deeply believed that vaccines hurt him and others. However, she never suspected that he would resort to violence. The shooting has sent shockwaves through the CDC community, with thousands of employees working on critical disease research left shaken and traumatized. The incident has also sparked controversy, with some laid-off CDC employees calling for the resignation of Health and Human Services Secretary Robert F. Kennedy Jr., who has been a vocal skeptic of vaccines and has spread distrust about COVID-19 vaccines. Kennedy's history of skepticism has been well documented, and his appointment as secretary has been met with criticism from the scientific community. His decision to cut $500 million from vaccine development funding has only added fuel to the fire. But here's the part that's often missed: the impact of leadership on shaping public discourse and the consequences of rhetoric that undermines trust in our institutions. As Fired But Fighting, a group of laid-off CDC employees, pointed out, Kennedy's continuous lies about science and vaccine safety have fueled a climate of hostility and mistrust. The group called for his resignation, arguing that he shares responsibility for the violence and should be held accountable. And this is the part that's most troubling: the growing security concerns and the fear that employees could continue to be targeted. Senior CDC leadership has announced a full security assessment following the shooting, and employees have been asked to remove old CDC parking decals from their vehicles. The incident has left many feeling like sitting ducks, vulnerable to attack, and unsure of what the future holds. As we reflect on this tragic event, we're forced to confront the darker aspects of our society and the consequences of a polarized discourse that often prioritizes ideology over evidence. The question is, what can we do to prevent such incidents in the future? How can we foster a more nuanced conversation about the complexities of health, science, and politics? And what role can leadership play in shaping a more informed and empathetic public discourse? These are the questions that we must grapple with. And it's only by engaging in a thoughtful and respectful dialogue that we can hope to find answers. So we ask you, what are your thoughts on this incident? Do you believe that leadership has a responsibility to shape public discourse and promote trust in our institutions? Share your opinions And let's start a conversation.